Part of the reason why I went to bariatric surgery is that I've always loved watching patients transform. Their self-esteem grows so dramatically that you may actually change their path of life. And I've seen it. I'm Dr. Edward Yatco. I'm the Medical Director of Minimally Invasive and Robotic Surgery at Valley Medical Group and the Subspecialty Director of Bariatric Surgery at Valley Hospital. Bariatric surgery involves operating on the digestive tract of the patient in order to make it so that the patient absorbs less calories or is not able to eat as many calories. Okay, this allows them to lose a tremendous amount of weight. The procedures that we have for bariatric surgery include restrictive procedures such as sleeve gastrectomy and gastric banding. I prefer to do sleeve gastrectomies. It doesn't require any placement of any foreign body within the abdomen, and it usually results in very guaranteed weight loss. The other operation I like to specialize in is modified duodenal switches, which is like a sleeve gastrectomy, but with an added component of malabsorption, and that also results in increased satiety for the patient. We do offer gastric bypass and also gastric banding procedures. A bariatric surgeon treats primarily morbid obesity, but also the other medical conditions that go along with being morbidly obese. Bariatric surgeons also treat recidivism, which is weight regain after bariatric surgery. One thing I do want my patients to understand is they play a very active and important role, especially in bariatric surgery. The bariatric operation is a very powerful weight loss tool, but it's only the initial part of the weight loss journey. And the success of the patient really is largely dependent on what the patient does after the surgery. The patients who follow our aftercare instructions and are able to make permanent lifestyle changes such as a good diet and regular exercise will achieve long-lasting and significant weight loss. Robotic surgery is performed in a minimally invasive or laparoscopic manner. The surgeon sits at a console and has some hand manipulators that allow the surgical robot to mimic those hand signals within the patient's abdomen. Using the surgical robot, I'm able to treat conditions such as gallbladder disease, or I can fix hernias, both inguinal and ventral hernias. I also treat gastroesophageal reflux disease or heartburn, especially if a patient has a hiatal hernia, and I can do a hiatal hernia repair using the robot. My personal philosophy in medicine is that the doctor-patient relationship is of the utmost importance. I believe that good communication is essential for the doctor to be able to understand fully the problems that the patient is confronting and what the patient expects from the treatment.